Welcome to this short video series on myalgic encephalomyelitis, also known as ME. And I'm going to go straight in and start with, why should I care? Let's take a step back. How many diseases can you name? Probably quite a lot. So aside from the fact that there are probably already lots of diseases that you do know about but which you don't have yourself, you should know about ME because it is a post-infection disease. Yes, that means it typically develops after a bacterial or viral infection. And I imagine you have had some sort of bacterial or viral infection at some point in your life, and probably will again, which means there is always a risk that you or someone you care about could develop ME. But what is ME? Well, it's a chronic disease characterized by severe energy limitations and a disproportionate response to exertion, and that's called post-exertional malaise, PEM. PEM is felt as a severe weakness and worsening of symptoms like pain, headaches, dizziness, flu-like symptoms, noise and light sensitivity, cognitive impairment, and heart palpitations, amongst many others. And you might be thinking, but I heard ME is all in the head. Let me stop you there, because it is absolutely not. While that was a common misconception for a number of decades, that has now been disproven. What we do know is that it can affect the immune, neurological, autonomic, endocrine, and gastrointestinal systems. Now, ME can be mild, moderate, severe, or very severe, and patients can transition between the different severities over time. And although the features of the disease are the same across all severities, the impact on patients' lives obviously differs. Even at the mild end of the spectrum, although patients might have some functionality, can do domestic tasks independently, might be able to work, they may need support, they may have issues with mobility, and they may struggle to manage any kind of other activity outside of work. So yes, that's a pretty big impact on someone's life, even at the mild end of the spectrum. And at the very severe end of the spectrum, patients will be completely bedbound. They're likely to have severe light and noise sensitivity and often wear eye masks and noise-cancelling headphones. They will be completely dependent on caregivers, and in some cases may not be able to swallow and therefore need to be tube fed. Welcome back to this video series on ME, and this time we're going to be discussing why ME is not in fact a rare disease. There seems to be this general misconception that ME is an extremely rare disease and it doesn't affect lots of individuals, and that is inaccurate. In fact, the UK criteria for rare disease is a 0.05% prevalence in the population. Let's have a look at this graph here prepared by CrunchME. This graph shows here with the dotted line where the definition for UK rare disease falls at 0.05%. You can then see, relative to that, what the estimate of the ME prevalence in populations is. And even at the lowest estimate, you can see that it far exceeds the rare disease threshold. So no, it's not a rare disease. Its prevalence in the UK is actually comparable to other diseases which are much better known. It's worth saying that it is hard to pinpoint the exact number of people who have ME in the UK. And that's because it often goes undiagnosed or misdiagnosed. The commonly accepted estimate is from 2002, yes, 23 years ago, and that was 250,000. But there's a 2025 study, which is yet to be peer-reviewed, which estimates that that figure might be closer to 410,000. At this point, it's probably useful to mention long COVID, because there is a lot of crossover between long COVID and ME. In fact, estimates suggest that up to 50% of people with long COVID actually meet the diagnostic criteria for ME as well. For reference, let's have a look at some better known diseases and how many people they are estimated to affect in the UK. So we can see here that multiple sclerosis affects about 130,000. Type 1 diabetes affects about 368,000. Both of those are fewer than the number of people who are affected by ME at the estimate of 410,000. And then we also have rheumatoid arthritis, which is estimated to affect about 683,000. Hopefully this shows you that ME is not in fact a rare disease and affects a lot more people than you might have previously believed. But the striking thing about ME is not just how many people it affects, it is the impact it has on those affected. And we're going to show you more about this in the next few videos. Today we're diving into the impact that ME has on the lives of those who have it. I want to preface this video by saying that I will be making comparisons between ME and other better known diseases, but this isn't in any way intended to belittle the experience of those who have those other diseases. It's simply helpful to draw comparisons between different diseases and ME for context, since many people don't know just how severe ME is. Let's start with this graph from CrunchME, which shows the estimated disease burden of various different diseases in the US. Multiple sclerosis, rheumatoid arthritis, ME, and diabetes, measured using what's called Disability Adjusted Life Years, or DALYS. And this aims to measure the impact a disease has on both mortality in terms of lost life years and disability. And in this graph, it's measured in 100,000s. A note for the ease of fitting it on a page in a way that is easily visible, it uses a log scale on the y-axis. Now, what this graph shows is that the impact of ME on the quality of life is higher than that for multiple sclerosis and rheumatoid arthritis, but lower than that for diabetes. Although it is also worth noting that this graph covers pre-pandemic ME, and actually post-pandemic ME and long COVID combined has a much higher disability adjusted life year figure at 5,738, which is in fact higher than the figure for diabetes. We can also look at this second graph from CrunchME, which shows us the, bear with me, EQ5D3L figures for the same diseases. Now, the EQ5D3L, catchily named, is a widely used generic questionnaire that assesses health-related quality of life. It covers 5 dimensions: mobility, self-care, usual activities, pain, discomfort, and anxiety, depression. And it asks respondents to rate which of 3 severities best describes their state of health. It's worth noting the general population has a reading of 0.85, so it's not perfect health. Even then, we can still see that the figure for ME is significantly lower than for other diseases. In the next video, I'll be moving on from showing you graphs about the impact of ME on lives to describe the ME experience based on the words of those who actually have it. Welcome back to this video series on ME, and today we are talking about the ME experience. As a reminder, ME has many different debilitating symptoms which may be triggered or worsened by any level of exertion. Yes, any level of exertion. We aren't talking about running marathons or hiking mountains here. In fact, exertion isn't always physical. With ME, exertion can be mental, physical, emotional, or social. So at the mild end of the spectrum, it might be walking a few kilometers on a flat surface at a steady pace, or it could be spending too long at a social event. At the more severe end of the spectrum, it isn't even just about active exertion, it's also about stimulation, noise, light, touch, triggering symptoms. So exertion could be sitting up in bed or moving with a lot of help to the loo, but it could also be exposure to natural light through a window, the noise of people talking, noise from outside, and these are things that are often out of the individual's control. And it's why many people with severe and very severe ME wear earplugs, noise-cancelling headphones, listening to nothing, and wear eye masks throughout the day, even when they aren't sleeping. Although symptoms can stabilise over time, and someone with severe or very severe ME might transition, if they're lucky, to a more mild or moderate state, that requires careful management and specialist support, and even then, there is still no cure. As well as the physical impact on lives, patients with ME also have to deal with difficulties with getting appropriate support, an accurate diagnosis, and also stigma from society, sometimes even from friends and family. This adds mental health struggles to the already crushing physical burden of the illness. I asked my followers with ME to describe their experience of the disease, and this is what they said. A relentless, painful nightmare from which I cannot wake. Living hell, spending years just existing, trying so many different things in the hope that they help, while everything and everyone moves on without you. Ambition trapped in a body that can't do anything. It's a prison. There is no escape. Being sidelined from my own life, my team plays on while I have to sit and watch from the bench. ME has separated me from everything I was. Friends, hobbies, intelligence, hopes. Missing out on life with my children. I live my life in small, spread out pieces. What I used to do in a weekend now takes me a month. I feel like someone I don't recognise. Isolation and loneliness. The slow death of a life I loved. It's debilitating and it's relentless. I used to run over 35 miles a week and now I can't even leave the house. It's losing the life I once had and grieving the future I had planned for myself. It's watching the world move on while I am left behind. It's the complete destruction of my old life. It's being trapped in a failing body. As these testimonies suggest, living with ME is incredibly difficult. Your body stops working and it affects every single thing you do. Every decision that is made in a day, which most people wouldn't even think about consciously, is dictated by the limits of your body. And that is incredibly restricting. In the next videos, we're going to talk about scientific findings, funding, and what can be done to help those with ME. In the third video in this series, we looked at what's called the Disability Adjusted Life Year Measurement, DALY, for ME, diabetes, multiple sclerosis, and rheumatoid arthritis. And we can see here that ME has a higher Disability Adjusted Life Year reading, meaning a greater impact on life, than multiple sclerosis and rheumatoid arthritis, and when combined with long COVID, higher than diabetes as well. So now the big question, how does funding for these diseases compare? Let's look at this other graph prepared by CrunchME, which shows the amount of funding per disability adjusted life year for each disease. And we can see here very clearly that the figure for ME isn't even in the same ballpark as for other diseases. $14 per disability adjusted life year is less than 5% of the next highest funding figure, which is for diabetes, and just 2.4% of that for multiple sclerosis. So why is ME so underfunded? Well, there's a lot that can be said in answer to that, but at a high level, ME was psychologized for decades, and that basically means that doctors said that it was all in patients' heads. Because of that and the stigma that has grown and persisted in the medical community around ME has been sidelined from research and funding. And unfortunately, that means that we aren't yet sure of what mechanisms are at play in the bodies of those with ME to create such severe symptoms. But research has been happening, largely funded by charities like ME Research and the Open Medicine Foundation. And that research has brought to light certain physiological abnormalities in patients with ME, which align with symptoms that patients experience. In summary, research has observed the following in patients with ME. Number 1, metabolic dysfunction and impaired energy production. Number 2, chronic immune system activation and exhaustion. 3, anomalies in the operation of the vascular and cardiac systems. And number 4, autonomic dysfunction. In other words, dysfunction of the part of the nervous system responsible for all of the involuntary processes that happen in the body that are vital for life, like regulation of heart rate, blood pressure, breathing, and digestion. It's therefore no wonder that people with ME experience such severe and wide-ranging symptoms. And what's most striking is that given how little funding has been allocated to ME in the past, we have still identified all of these physiological abnormalities in patients with ME. So imagine how much could be observed and detected if ME only received the amount of funding that it deserved. These findings bring so much hope to the ME community. Observing what's going wrong in the body is the first step towards understanding the disease better, finding a reliable biomarker to improve the process and accuracy of diagnosis, and hopefully finding an effective treatment or a cure. In the next video, we're going to talk about what's needed and what you can do. Welcome back to the final and arguably most important part of this video series on ME. What needs to be done, especially in the UK, to help people who have ME? Number 1, increase public funding into biomedical research. As we saw earlier in the series, ME has a huge disease burden and prevalence, and the funding that it receives is woefully low relative to those things. In fact, the total figure for NHS funding between 2015 and 2020 was just 6 million. Let's break that down. That's £1 million per year, or £2.50 per patient per year, which, as you can probably imagine, is nowhere near enough funding. Number 2, stop funding disproven and harmful approaches for treating ME. And by this, I mean things like graded exercise therapy, which we now know to be harmful in patients that experience post-exertional malaise. So funding into approaches like this should not be happening because it's not going to lead anywhere. As we saw in the last video, there is enough evidence to prove that there are physiological abnormalities in patients with ME, and that is where research should be focused to have the biggest impact. Moving on from funding, let's talk about operational things that need to change. So number 3 is the establishment of national registries of patients with ME. These national registries already exist for other diseases, for example, diabetes. So there's no reason why there shouldn't be one for ME as well. Why is it needed? Well, it helps to keep track of how many people have ME. And as we talked about in the first video, that figure is actually probably much higher than currently thought. Therefore, it might motivate better funding, more attention, and it could speed up the process of recruiting patients with ME into clinical trials and studies. Number 4, establish specialist NHS clinics for ME patients. And that's to bridge the gap between new research and clinical care so that there are centres of excellence where the knowledge about ME is completely up to date and patients can expect to receive treatment that is sensitive to their level of severity. Now, number 5, the next point, developing an NHS protocol for the treatment of patients who have severe and very severe ME. This is especially important in hospitals to stop easily preventable deaths of people who have ME. As mentioned earlier in the series, people who have severe and very severe ME are very easily triggered by external stimulation, noise, light, touch, all of which you are heavily exposed to in a hospital environment. There's not currently a protocol for managing and minimizing this in a hospital environment. Ideally, such protocol should be updated regularly in response to findings from research and clinical trials. Finally, on the operation front, and number 6, create and update on a regular basis a list of off-label medications that can be used for managing the symptoms of ME. There are a lot of medications that show promise or benefit to some cohorts of patients with ME, and introducing a list like this would enable primary care practitioners or specialists to prescribe those medications to allow patients with ME to experiment with known medications that have already passed safety trials more easily on the NHS. Making a list like this has been done in other places like Austria, Germany, and could include medications like low-dose naltrexone, Mestinon, and low-dose Abilify. Moving on from the operational things and to the final point, number 7, education. I'm talking about education in medical schools and of primary care medical practitioners to ensure that they are kept appraised of the recent findings on ME, including the physiological abnormalities to look out for, including the diagnostic criteria for ME and the precautions that need to be taken when caring for people with ME, especially those at the more severe end of the spectrum. Of course, all of the things I discussed earlier in the operational side will all help with this education point. ME is a really devastating disease. It has a huge disease burden, and those who have it have their lives absolutely decimated by it. If we can introduce these changes like better education, better operational support, and better funding for appropriate research, we can make a really big difference for people who have ME. I urge you to share this video with other people so that they know what needs to be done. And if you've just watched this video and you haven't watched the earlier videos in this series, I really urge you to go and watch them so that you understand more about ME than you did before.